Good afternoon, all. In fact, this topic already my previous two speakers, Dr. Tityal and Dr. Das, they have already mentioned. So there is a sort of overlap and repetitions. And this topic particularly focus on introspection. The people all sitting here are all expert teachers. So what happens over the course of years? What happens sometimes if we just start forgetting or we change our mindset, something else happens. Otherwise, for younger teachers, there are lots many things to introspect. So first and foremost is that when I am in a teaching profession, is that my passion? And do I get joy when I impart knowledge to others? So these are the two basic parameters. One has it, only then is expected one is in the teaching profession. Then third thing, like, are we well trained to be a teacher? Then we have to introspect, do I effectively teach and practically train my residents? And then do I come down to the level of my residents, JRs, different category of JRs, senior residents or junior colleagues? Then am I maintaining the pace with the advancement in science, technology and methods of teaching, or just passing the time, or just forgot, or just there is no desire to learn? And then do I conduct bedside clinical rounds with residents as a rule? Because of the daycare surgeries as well, nowadays you do not admit the patient, but however in medical institution, some beds should be kept, and the trend of taking rounds with the residents, which will tell us empathy towards patient, how to tackle that they will understand. So bedside clinical rounds are very important. Do I assess my residents on regular periods for their knowledge and skill, or just it's a formality? This is basically introspection for everyone, because there are several things we just carry on the things like, okay, this is to be done, this is to be done, but how much we are passionate? Do I orient and interact with my residents when they join? They have come to a new sphere in ophthalmology, and they were just passed MBBS and did internship, which is not done properly by the residents or by the students nowadays. So I mean, they are coming to a new area. So am I interacting with them and orienting them? And do I apprise them about working in a new scenario and about ophthalmology curriculum at the beginning of the semester? There are protocols that you have to send the new JRs to different departments for interdepartmental learnings. So am I really exposing them, sending them honestly to different areas, assigned hours to learn radio diagnosis part and pathology part, other things, and research methodologies training session? Are we facilitating them for self-directive learning? Are we genuinely passing them in your exam, or do we just feel that a poor pass percentage will reflect adversely upon us? Or so many residents failed, not passed. Or sometimes it may be that after 6 months we will have to conduct supplementary exam. It's another botheration for us, so just pass them. Of course, some people say that they will learn, they pass them, they will learn throughout life. But then just passing them without their learning will create a slow poisoning. Another very important thing, am I pulling down the PG residents during teaching and training? And simultaneously, this is something like, there are certain, sometimes it happens, sometimes we are criticizing our colleagues in front of the residents. Another something very bad. Am I focused on my clinical work only? Is teaching a secondary task for me? This also happens. So am I exposing my all residents as a protocol to exposing them to all specialized gadgets? Are they getting enough surgical exposure? Am I maintaining the record? Are we maintaining the logbook? Are they maintaining, and I'm just checking it? And for those who are head of departments, are they monitoring their learning objectives on a semester-wise basis? For the HODs, do they feel like their postgraduates would be competent enough to work independently after they pass out? So there are few suggestions. A good clinical medical teacher stands upon three poles: clinical work, second teaching, and third research skills. So we have to prepare training modules, assess them more frequently, and medical institutions need to take steps to reward good teachers and help the not so good teachers by improving through faculty development program. The concept should change from the teacher to that of a facilitator of learning or a motivator. And this teaching and learning should be evidence based. Use of simulation, dry lab, wet lab, technology assisted, like there are various technologies which can assist, like webinars, web resources by AIOS, ICO, All in American Academy, Wills Eye Hospital, animated online resources, tools for online collaboration, tips and tricks for PowerPoint presentation for your residents, and mobile phone app based support. So to the last, we must update ourselves with the advancement of science technology and cope up with the changed culture, attitude and values of new generation. This is also another very important point, because we see that residents threshold has also nowadays decreased. Thank you very much.